Hi, my name is Tori Bauer-Pisani, and today's date is May 7th, 2024. Hi, my name is Tori Bauer-Pisani, and today's date is May 7th, 2024. And for my diseases of the cell final, I am presenting on Gaucher disease. Gaucher disease was named after the French physician Philippe Charles Ernest Gaucher in 1882, where it was during that time that he was completing school to become a dermatologist that he came across a case of a 32-year-old female with splenomegaly, or an enlarged spleen. And he, at the time, thought that she had splenic cancer. But it wasn't until 1965 that it was discovered that she indeed had Gaucher disease. And Gaucher disease is an accumulation of lipids, specifically glucose cerebroside, within various tissues and organs throughout the body. Gaucher disease is an autosomal recessive genetic disorder, which means that both parents are carriers of the disease and have a recessive allele of Gaucher disease on their genotype. And both of these parents can have children that are either unaffected, are unaffected carriers of the disorder and present with no symptoms, or have an affected child, which is a 1 in 4 chance or 25% chance. And this disorder is one of the most common autosomal recessive disorders amongst the Jews of Ashkenazi, where it is 1 in 450 likely to have the disorder. Gaucher disease is caused by the mutations in the GBA1 gene, and this results in a lysosomal deficiency of glucose cerebrosidase activity. Glucose cerebrosidase is an enzyme that breaks down glucose cerebroside lipids, which are typically broken down by the lysosome of the cell, but in this case, they are unable to be broken down, and the accumulation of the glucose cerebroside lipids cause a toxic abundance primarily in the spleen, liver, and bone marrow. I will describe in the next slide a little bit about lysosomal storage disorders and what that necessarily means in Gaucher disease and how that affects the organs inside the body. So as I mentioned before, Gaucher disease is caused by mutations of the GBA1 gene, which results in a lower activity of the glucose cerebrosidase enzyme. And so far, we have appreciated a few mutations found in molecular diagnostics, which are able to classify people in different disease types under the umbrella of Gaucher disease. And that would be type 1, which is a non-neuropathic form of Gaucher disease, type 2, which is an acute neuropathic form, type 3, a chronic neuropathic form, and then 2 more rare and lethal forms are perinatal lethal and cardiovascular. Now, before I break down some of the phenotypes associated with the disease, I want to first explain exactly what a lysosomal storage disorder is. So on the figure in this slide, we have the cell and the cell nucleus of a macrophage. And the macrophage's job is to engulf waste particles for the lysosome to break down and recycle back into the system. So here we see a cell, and it is engulfing waste material, the red material, by phagocytosis. And as that is phagocytized into the cell, there's a lysosome that forms that contains the waste material. And in this figure, you can see it's the blue circle that has the red material in it. Normally, the waste material is degraded by the enzyme, and in this case, the enzyme that is produced due to a functioning GBA1 gene, and the cell is able to take in all of the glucose cerebroside and break it down, and that is excreted by the cell, and that would be a healthy person. For Gaucher disease, unfortunately, the lack of the enzyme means that a lot of the waste material will stay inside the lysosome, and the cells will fill up with all of the waste material inside of it. And unfortunately, that will lead to fatty accumulations in several organs of the body, like I explained, the liver, the spleen, and the bone marrow. Fatty accumulations there will lead to a lot of systemic disorders and will start acutely affecting the spleen and the liver, and by enlarging them and causing those those organ function tests to rise and will cause a cascade of effects on the body. The mutations that I have listed here, I have 6 ones that are found in molecular diagnostics that we are able to describe for our patients. The one highlighted in yellow, the N370S, is the most common genotype, and that is associated with people that have type 1 Gaucher disease, which is the non-neuropathic form. Individuals with this form of Gaucher disease can have a near normal life expectancy with appropriate treatments. A lot of their symptoms, such as hepatosplenomegaly, anemia, and thrombocytopenia, often improve with therapies such as enzyme replacement therapy, which I will talk about later on in the presentation. And they also, unfortunately, have some bone disease that can progress more slowly, but it can stabilize with treatment. A lot of times, this form of the disease in type 1 doesn't present itself until later on in life. However, but with type 2 Gaucher disease, which is the acute neuropathic form, it is severe and rapidly progressing, primarily in infants. The prognosis is generally poor. In type 3 Gaucher disease, with a chronic neuropathic form, it is milder than type 2 with a later onset of symptoms, usually later in childhood or adolescence, but can present with similar symptoms. The life expectancy is generally reduced, but longer lived than type 2 Gaucher disease. And then with perinatal lethal type Gaucher disease, the prognosis is extremely poor, and it is the most severe and the rarest form. It is characterized by the earliest onset of symptoms. It can range from either pre-birth or right after birth. And unfortunately, these babies usually die very quickly after being born. And the cardiovascular type of Gaucher disease is exceedingly rare and is very atypical, where the disease will primarily affect the cardiovascular system, leading to the deposition of glucose cerebroside in the heart valves, arteries, and other vascular structures, as opposed to the classic form where you will see an accumulation more so in the liver and spleen before you see accumulations in the cardiovascular system. With this figure here, I just wanted to highlight that there are several metabolic disorders that are caused in a single metabolic pathway. And here I circled Gaucher disease, which, as I mentioned, is caused by a lack of glucose cerebrosidase, which is the enzyme involved in lysosomal biochemistry, but is related to several other diseases such as Tay-Sachs, that are related to the same metabolic sequence. So in this slide, I will talk about some of the signs and symptoms that are associated with Gaucher disease and some of the intricacies of the disease symptoms in the different types of Gaucher disease. So classically, Gaucher disease is characterized by hepatomegaly and splenomegaly, as well as hypersplenism and pancytopenia, which could be appreciated in blood sampling. The disease also causes severe joint pain due to the accumulation in the bone marrow, and this can also lead to joint degradation, such as osteoporosis. Classically, with hepatomegaly and the enlargement of the liver, as well as the decreased function of the liver, this will cause the skin to have a jaundiced or yellow to yellow-brown appearance in the skin. Some of the symptoms directly related to certain subtypes of the disorder include impaired olfaction and cognition, as seen in type 1 Gaucher disease, and then for type 2, severe convulsions, hypertonia, apnea, and intellectual deficits. And then with type 3, myoclonus, seizures, dementia, and ocular muscle apraxia. In the figure in this slide, I just wanted to show a little bit of what hepatomegaly and splenomegaly look like, especially in an infant. So this picture, you have a little boy who unfortunately has an enlarged liver and spleen due to Gaucher disease. And then I will explain in some of the pharmacotherapies And in this case, this is him before and after something called enzyme replacement therapy, which was able to reduce his liver and spleen to a more normal size. So currently, treatments for Gaucher disease are categorized into two different therapies. One is called enzyme replacement therapy, and the other is substrate reduction therapy. So for enzyme replacement therapy, in general, these type of therapies provide an IV infusion containing the enzyme that is deficient or absent in the body. And in this case, there's a mutation of the GBA1 gene, which is glucocerebrosidase. Therefore, those that are receiving the therapy are getting an IV infusion of the enzyme, which will aid in the clearing of the fatty accumulations in the lysosomes of the cell. So therefore, a lot of times those that are presenting with hepatomegaly or splenomegaly, their organ size will be reduced as their cells are not swelling with as much cellular debris. Some of the FDA-approved therapies are Cerezyme and FPRIV, velaglucarase, and a lot of times those that have types 1 and 3 Gaucher disease are eligible for this therapy. Unfortunately, those with the acute neuropathic or any sort of neuropathies associated with Gaucher disease are unable to not necessarily receive the enzyme replacement therapy, but it's not as efficacious as these therapies typically cannot replace any sort of enzyme deficiency in the brain due to the blood-brain barrier needing to be penetrated. This type of therapy does not necessarily correct any sort of genetic defect, but does aid in lowering symptoms of the progression of disease. The other type of therapy is a substrate reduction therapy, which is an orally administered small molecule drug that is distinct from enzyme replacement therapy, as the goal is just to reduce the substrate levels of the toxins that accumulate. So in this case, the substrate reduction therapies are used to inhibit the first steps in the glycosphingolipid biosynthesis. And there are two drugs, two FDA-approved drugs on the market called iliglustat and miglustat. I apologize if I am mispronouncing those. This therapy just has a different approach in order to clear out the substrate, and they're continuing to make other substrate reduction therapies that can cross the blood-brain barrier and potentially benefit those with type 2 as well as type 3 Gaucher disease. Some of the other treatments that are not as common but can still be helpful is hematopoietic stem cell transplantation, which has been phased out because it can be very dangerous and expensive, as well as splenectomies for those cases that are very severe and it would benefit to just have the spleen removed to help with prolonged life expectancy. As far as current studies and future implications for Gaucher disease, there are several papers now that are looking at the long-term effects of the current pharmacotherapies, such as for the enzyme replacement therapies as well as these substrate reduction therapies. And they're looking to see if there are any long-term effects on the body systems, on the organ systems, and if there are any negative connotations to these therapies. I believe one of them was looking at endocrine disorders that could potentially arise due to the administration of enzyme replacement therapies, but so far it's been unclear whether or not there are some long-term effects with enzyme replacement therapies. Of course, there are other studies that are analyzing the specific Gaucher disease genotypes and those that have minimal information on them, and whether or not there are other pathophysiological characteristics that could aid in future modalities for pharmacotherapies in order to treat Gaucher disease. I hope you enjoyed my presentation. Here are my references. Thank you so much.